Is the province ready to deal with the increase? Joining me to talk about this and more is Gauteng Health MEC, Dr. Bandile Masuku. MEC, good evening and thank you for your time. To quote the province's premier, our health services are feeling pressure already, and this is because the pandemic is running far ahead of what we projected. The pandemic is increasing beyond what the experts have projected. Is that the true reflection of the picture?
Yes, good evening and good evening to your viewers. It is a true picture of what we are seeing, and you should recall that the majority of the modeling that we have done it with the context of having being the country being on level 4 or level 5. Hence, the issue of restrictions and decreased movement was taken into account. But with us moving to level 3, it actually meant that we should do a bit of remodeling, which brings the peak closer to what we expected, which will be mid-August.
Now, if you're looking at the patients admitted now sitting at over 3,000 or so, and we're only sitting at 54,000, with your prediction, you're saying that number should double or triple, even 6 times that by the end of August. And saying that the recovery rate stays where it is sitting right now, it means we're going to need 6 times more beds to be able to handle that. Are we able to bring that to online?
No, I think the most important aspect that we need to clarify is that recovery is also a function of time. That out of all those who are infected, who are active cases now, after 14 days, most of them, if not all of them, will be considered to have actually recovered, particularly if they have not had to be in a hospital. But secondly is that if we don't put anything, we don't do anything and allow things to be on a free fall as it is now, it might mean that this can even be worse. But we are thinking that when we put into place these regulations that are there already, if we can be stringent on them and enforce them more forcefully, you know, some of these figures could be reduced, and it's something that we are aiming to do, and that's what we are discussing as a province and with our national leadership on how we can put and enforce some of the regulations that will give us a greater impact of reducing the rate of transmission. So
what you're presenting to the National Command Council is that the lockdown relaxations are overwhelming our health system. That's pretty much the sum total of it.
The sum total of it, as you have put it very clearly, and it's accurate, that the more we open up the economy, the more the transmission rate becomes high. And I think we have the data and we have the evidence in front of us, which tells us that under a certain level of lockdown with some regulations, the infections were quite slow. And we also need to indicate that it's not about stopping the infections essentially, but it's just to make sure that we slow down the rate of infections so that we give the opportunity to the healthcare system to be able to take care of those who require help at a given time.
Why call for intermittent lockdowns? What were you doing in the first 3 weeks when we had the lockdown to prepare for the rise and the peak? And one would even say, what were you doing in the subsequent lockdowns, lockdown level 4, lockdown level 3, as we were going down? The idea was that was buying you time to prepare for this peak.
There's a lot that has happened, and I'm certain that the numbers that you are talking about in terms of the number of beds were in initial point were not even there or available for use. Even the discussion with the private sector were not even at the high stage and even engaged at that level. And the number of beds that we have repurposed and refurbished within our own facilities, which were not there initially. So now we do have them, and that is the reason why we even passed June without any particular problems. So it's an important thing that the lockdown did give us time, and it also gave us time to push away, you know, the peak from what it was intended to be. So there are a number of reasons. It's not just about that, and we are, in a sense, going to be putting more effort in that regard.
MEC, I'm going to ask you to stay with us because we want to find out a little bit more about what you are doing as far as making sure that the level of adherence to social distancing becomes paramount in the province. But also we want to talk about the reporting of those who are succumbing to this virus. Seemingly your numbers are delayed. We're only going to be seeing them today, and you have not reported on the number of those who have passed on since Thursday. So MEC, stay with us. We'll continue when Flatten the Curve continues with the MEC for Health in the province, Dr. Bandile Masuku. Western Cape did not go back to level 5. Why Gauteng?
No, we just think that it's important for us to control the transmission rate, and I think with all what we have in terms of the number of the people we have in the province, which is around 15 million, we might be faced with a bigger problem and a bigger challenge than Western Cape. And in any case, we are not in any way trying to compare ourselves with them. We've got our own unique challenges and our own challenges that we are facing in the public system. So it becomes important that we approach it in a manner that is appropriate for us as a province.
I know you don't want to create alarm and get people anxious, but in real time, as we sit right now, how severe is the resource availability gap? For example, we've got 151 people on ventilators, if these numbers are correct, as of the 1st of July. There could be slightly more. Do we have enough ventilators should that number double?
Should the number double, yes, we do have, but the issue is that most of them are still in the private sector. And the issue that we are looking at currently is that the majority of the people that are hospitalized have not required, actually ventilation. Only less than 1% have actually required ventilation, because we are using all the other forms of actually managing shortness of breath and difficulty in breathing other than using a ventilator. So there are other means, but we are in a sense receiving more ventilators from donations, and also the ones that are coming from the CSIR, from the 20,000 project that is run with DTI.
There is a concern around real-time assessment. You have not reported the number of deaths since Thursday. Besides that, you've got PIUs and COVID-positive patients rising, particularly the PIUs who are still being investigated, and they are sitting and they're waiting for their test. There's a sense that the system is quite slow and delayed.
Remember that the tests that we are using, they still have a time lag, a 2-day time lag. If we are lucky, we do get 24 hours to 48 hours to get the results. So those are just the tests that are available that we are using in the country. We have not had an opportunity to get the rapid tests. There are those that have been introduced but have not been that effective in terms of usage. And in terms of reporting of death, all the statistics the ones that you have been actually reading out are statistics that are provided to us and to the public by the national minister. So there is a very big process that goes through in terms of auditing and verifying those statistics before they can be confirmed. Imagine if we can actually report some of the statistics of death and we then had to retract later. So the process of verifying and actually ratifying those figures, they take a bit long, and it's a process that belongs to the national ministry. So even us as the province, when we have to give our own statistics, we wait for the ones that come from the minister, and then we can be able to do the general breakdown as we normally do every day.
How does that impact on your modeling then? Because part of the modeling, especially now with the numbers rising, is that the real time needs to be shortened. In other words, we need real-time data that would allow for you to make decisions right now that are important for right now to save lives.
I think more and more, I think decisions are taken on real time, and in a sense that the modeling does do a longer, shorter term actually process of modeling. We don't have a daily modeling that you could see, or a weekly one. We do have a monthly one, which also takes into account the flow or the negativity of having to have the lag time in terms of results, which by and large is an accepted norm of around 24 to 48 hours in that regard.
You've called on the South African National Defence Force to come and assist. What exactly do you want them to do?
We are working in different aspects. The bigger one that we are, doing with them is to putting up a field hospital, which will be able to cater for the, for the gap of the beds that we would be actually requiring towards the end of July. And the other one is just to put some of the fever tents in the hospitals in Tshwane and in the Valley in Sedibeng, and also in terms of the human resource that they have, which will also add on into what we are, the ones that we are recruiting, the ones that we have employed, to add on, in terms of numbers.
The transmission dynamics have changed because now it's a community transmission and we are seeing very low levels of adherence to lockdown regulations. Are you looking at assessing your methods of control, and what are you suggesting?
One of the ways is to just reduce movements, reduce all the, public gatherings that we have seen. We have seen people gathering in marches, even though they were raising important matters, but those marches ended up becoming one of them that will cause us outbreaks. We have seen people gather in numbers in terms of funerals, and even the after parties, after funerals have actually spoiled out in Gauteng. So one of the important things which is enforceable, which is a regulation that we can do, which is it's available on our hands, is just to reduce this type of public gatherings and make sure that people stay in their homes and they only move out from their homes and go into the public only when there's a necessity and when they're going to buy something or going to work. Besides that, just to reduce the element of movement around.
Charlotte McGregor reporting loads in the trauma unit. How are you assisting them, and how are you working with them towards addressing that situation? Because it is one of those identified COVID-19 hospitals in the country which really does need those beds available.
Yeah, basically all the hospitals are going to manage COVID patients. I think we've moved from the point where there will be identified hospitals. And one of the ways to help them is to also increase the capacity of the accident emergency department in that relation, to make sure that PUIs are actually managed from a different space altogether, not from the casualty as it is, actually currently. So the fever tents are going to help us in that regard. But secondly, we know that the function of trauma in a main is a function of usage of alcohol. Hence, we are also thinking about the stringent regulation about availability and the usage of alcohol in general. So those are ways that we can be able to put up in place to make sure that we are able to protect the beds, those that we require, which now are taken up by trauma patients.
And finally, before I let you go, MEC, have you considered what the instability is going to cause for business of this intermittent lockdown? 2 weeks on, 2 weeks off. People who run businesses will tell you it does not work like that. You've got restaurants which are just reopening. You've got hairdressers which are just reopening. You want to tell them they've got to close down again. Already to set up for this reopening, they've put in money, investing to make sure that they are COVID-19 compliant.
It's a balance that we need to actually to play on. I think whilst we understand that we have to save livelihoods, we still have the principal constitutional obligation of saving lives. And I think we now, with the better insight that we have gathered with all the previous lockdown periods that we have had, we can be able to enforce some of the regulation, enforce the lockdown in a more strategic way that will give us more impact and more effectiveness. And it gives an element of predictive nature on how the business can be planned and how it can move actually beyond that. So it's just a balance that we need to play out and make sure that we don't really crash the economy, but we still have the ability to save lives with making sure that the healthcare system is able to also take a rest and breathe and be able to deal with all the other coming actually waves of infections.